All right, so hello and welcome. My name is Eunice Mathis. I'm a nurse educator with Florida Training Academy, which is a CNA and CPR training company located in Jacksonville, Florida. All right, so if you're in the Florida area, the test will be conducted, your CNA exam will be conducted by Prometric. And so the test that's on the screen is the Prometric Practice Nurse Aid Examination. Of course, these are not the exact questions that's on your CNA exam. However, these questions will give you an idea as to what to expect when you take the Florida CNA examination. Even though it's a written test, that's what we call it, the test is actually multiple choice. It consists of 60 questions, and you have 90 minutes to answer and complete. Unfortunately, at the end, you do not receive a score. Instead, you receive a pass or a fail. If you want to actually receive your score, your numeric score, you'll have to pay additional fees and wait about 3 weeks. You can contact Prometric to know if you're a CNA who made a 89% or a CNA who made a 96%. My job here is just to focus on you becoming a CNA. So without further ado, we're going to go ahead and start. Oh, and if you need to contact me, our website is www.fl.training.com. Again, Florida Training Academy. I'm reading directly from the screen now. All right, so it says, notice, this practice test is provided as a courtesy to individuals who are preparing to take their Prometric Nurse Aid Competency Examination. You are reminded that how well you do on these practice tests does not predict results on the actual examination. Directions. This practice test contains 50 questions. Each question has 4 suggested answers, A, B, C, or D. For each question, choose the one that best answers it. So we're going to review number 1. Number 1 states, a resident often carries a doll with her, treating it like her baby. One day she's wandering around crying that she can't find her baby. The nurse aide should A, ask the resident where she last had the doll. B, ask the activity department if they have any other dolls. C, offer comfort to the resident to help her look for her baby. D, let the other staff know the resident is very confused and should be watched closely. I find that a lot of students like to select B, but I want to remind you that all of your patients should be watched closely, not just the one who's wandering around and crying. So that would be a good reason that it's not D. We need to actually help this resident. And we can tell just by the actual statement within the question that there may be some type of cognitive, a disability. So maybe she has Alzheimer's or she has dementia. So the best answer is going to be C. You're going to offer her comfort. You don't want your resident in distress. You're going to offer her comfort and you're going to help her look for her baby. If you tried to go to the activities department and offer a different doll, well, maybe her doll had a brown complexion or a lighter complexion and the other dolls do not, or maybe it's a certain color that she's going to remember. So do try to find her, do try to help her find her own doll and provide it to her. Question number 2, a nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to A, change the indwelling catheter at the same time. B, ask another nurse aide to change the urinary drainage bag. C, change the bag asking for help only if the nurse aide has problems. D, ask a nurse to watch the nurse aide change the bag since it is the first time. All right, so you want to be thinking about patient safety. All right, if you've never done something before, don't risk injury, or, making a mess if you're spilling urine from the drainage bag. So the best answer is going to be D. You're going to ask the nurse to supervise. She's going to watch you since it's your first time. That way she can correct any mistakes. And if you need hands-on assistance, she can do so. The answer is not B, because CNAs do not delegate to other CNAs. Nurses delegate to CNAs. So you can't ask another nurse aide to come in and do your job. And additionally, if it's a task that you need to know how to do, you need to go ahead and learn how to do it. That's going to be the safest for you and those in your care. And it's also going to make you a more independent and knowledgeable CNA. Number 3. Before feeding a resident, which of the following is the best reason to wash the resident's hands? A, the resident may still touch his or her mouth or food. B, it reduces the risk of spreading airborne diseases. C, it improves resident morale and appetite. D, the resident needs to keep meal routines. All right, so the best answer for this one is going to be A. All right, so when you think about a resident who's maybe bedridden or just hasn't been able to get up and wash their hands, even though you're feeding them, sometimes when you bring the food towards their mouth, they'll either touch you or they'll touch their food and they're going to contaminate the food. So even if you're feeding a resident, you still want to go ahead and wash his or her hands. The answer would not be B. Hand washing does not prevent the spread of something that's airborne. If there's an airborne bacteria, we're going to have to wear a mask to prevent the spread of that particular disease. 4, which of the following is a job task performed by the nurse aide? And I know in different states, especially due to the pandemic, there are some medication administrative position provider courses you can take, etc. But right now, according to the Board of Nursing, you should not be given medications unless authorized and you've attended additional courses. Furthermore, if you're working in a hospital, they have pharmacists, they have nurses, they have doctors who will be administering medications. Respiratory therapists also administer, inhaled medications. So, and in the hospital system, CNAs do not give medicines. So the answer selections are the following. A, participate in a resident care plan and conferences. B, taking a telephone order from a physician. C, giving medications to assigned residents. D, changing sterile wound dressings. All right, so the correct answer is A. And simply what a resident care plan and conference is, it's a meeting about your residents. Who spends the most time with the residents? It's not the nurses, it's not the doctors, it is the CNAs. So you have valuable input. You're going to tell us if the person is constipated, if they're not eating enough, maybe they're not using their dentures because, they're hurting their gums. Whatever information you can provide is going to help us improve that patient's plan of care and to prevent disability. All right, so even if you have a good rapport with a physician and they're on the phone and it may be taking the nurse a while to get to the phone, you cannot take a telephone order from a physician. Remember what I told you before, you can't delegate any duty, so you can't take an order from a doctor even if you take it correctly, and a nurse would be able to accept it. The doctor would have to remain on hold or you can go and get the nurse a little more quickly or ask another nurse to take the order on behalf of the nurse who may be a little too busy to come to the nursing station right now. You cannot apply sterile gloves. So right now as a CNA, you're not a patient care tech. You're not somebody who's working in a hospital who's received additional training. Right now as a basic CNA, you cannot do sterile gloving, which means you cannot perform any particular procedure or skill that involves in being invasive. So you're not going to be, going into someone's, stage 4 pressure sore or wound in order to provide the dressing change. You're also not going to be inserting catheters. So in order for you to provide sterile wound dressing care, that means that you have to be, monitored and have been checked off on being able to be maintained sterile while doing a procedure. And for most facilities, that's not a CNA's job duty. Number 5, which of the following statements is true about range of motion exercises? All right, so you want to know about range of motion. Why do we do it? Why do we ask these patients to move? And if they can't move freely on their own, why do we go and exercise their extremities, passive range of motion? Number 1 is going to decrease pain because if they're stiff and they're not moving, it's just going to get stiffer. Number 2, whenever we start moving the extremities, we move them around, we also improve circulation. So range of motion exercise is good for, of course, keeping the joints active. It prevents them from losing muscle mass, and it also prevents blood clots. So how often do you want them to move? All right, so the answer to this one's going to be D. ROM exercises are often performed during ADLs, which stands for activities of daily living, such as bathing or dressing. So even if you have a patient or a resident who has hemiplegia, they've had a stroke and part of their body's paralyzed, just one half. On the half that is not paralyzed, you still want them to get the washcloth to try to wash whatever parts of their body they can, and you would take care of the weak side. So please do not let your patients, be immobile, not move at all. Our goal is to keep them as independent as possible for as long as possible. It would not be C, because if I'm providing range of motion exercises to someone, let's say who had, they're in recovery after surgery to a joint, such as, I'll say their leg. one leg bones, and they say ouch on repetition number 3, I'm not going to continue. I'm going to, if I'm not the nurse, I'm going to contact the nurse. If I'm the nurse, I'm going to contact the doctor. Maybe the person needs pain medications, but you need to be contacting and researching because, especially a person had like a hip replacement or something, and they're saying ouch doing the exercises, there could be a hairline fracture or something there, and you continuing the exercises is going to make their condition worse. Number 6, while the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A, put the hairbrush away and out of sight. B, give the resident the hairbrush to hold. C, try to dress the resident more quickly. D, restrain the resident's hands. A lot of students want to take the hairbrush away. If you take the hairbrush away, your confused person might all of a sudden become combative. That was a distractor. Nowhere in the statement did it say that this patient was combative, that they were going to hurt you, that they were going to hit you with the hairbrush. So while they're distracted and they're holding the hairbrush in one hand, you can dress the other arm. And then you can go ahead and put the hairbrush in the arm that's dressed, and you can continue the dressing process. So that would be the best answer for this particular question. 7, a resident who is lying in bed suddenly becomes short of breath. After calling for help, the nurse aide's next action should be to ask the resident to take deep breaths, take the resident's vital signs, raise the head of the bed, or D, elevate the resident's feet. So when someone is lying in bed, they have a higher chance of developing pneumonia, which is an accumulation of fluid. Okay, so I want you to think about that. Anytime a patient's lying in bed and they're short of breath, without an x-ray, I want you to think about accumulated fluid. And in order for us to move the fluid, we have to sit the patient up. So the best answer is going to be C. You've called for the nurse. That was the primary thing to do because that was a change of condition. And now you're going to raise the head of the bed, and that's going to move that fluid so that hopefully the patient or resident can still get aeration, in the upper parts of the lungs. The next thing you'll do, which was not, asked, but I'm going to tell you anyway, is that you would begin taking the resident's vital signs. That way, by the time the nurse enters the room, the blood pressure cuff's on, the pulse ox is on, and then she or he can take care of whatever's needed to assist that patient more. I do want to add that oxygen is a drug, and we already stated that a CNA cannot administer drugs. So if your patient's asking you to turn up the dial on the oxygen, or they don't feel like they're getting enough oxygen, please do troubleshoot to make sure that the tubing is connected to the oxygen. However, you cannot increase the flow of the oxygen. If you do so, you're stepping outside of your role. If the patient is still saying that they don't feel like they're, receiving enough air, that's something you want to notify the nurse about so that they can troubleshoot. 8, a resident who has cancer is expected to die within the next couple of days. Nursing care for this resident should focus on A, helping the resident through the stages of grief, B, providing for the resident's comfort, C, keeping the resident's care routines such as for bathing, D, give the resident a lot of quiet time and privacy. I find that a lot of students like to choose D, but that kind of isolates a dying person. Unless they ask for a lot of quiet time and privacy, I wouldn't give it to them. Plus, I'd be thinking that, wow, this person might be depressed, and it's already a very dire situation. So think of that person's emotional concerns and do not leave them isolated. The answer would also not be A, because sometimes people die and they never get through the stages of grief. It's like you'll find out you have cancer today, and unfortunately, it's an advanced form of cancer. And while you're still trying to get second opinions, figuring out, how to, just how your life goes on from here, sometimes they succumb to the diseases within a few days. So they never make it all the way through the stages of grief. However, you always want to be thinking about this person's comfort. Okay, so if they are expected to die, they have cancer, that's end stage. We're not going to do a lot of heroics. We're not going to be bathing them and just keeping up. You know, in the hospital, we harass patients, for lack of a better term. You know, we're in there taking their blood pressures every 2 hours. Maybe, you know, if their blood sugars are abnormal, we're checking their blood sugars more frequently. So they're not there to really rest. If someone's actively dying, you don't want to leave them isolated, but you do want to leave them comfortable. Okay. And we call that palliative care. And that's when sometimes the family members will consult hospice. 9, when given a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should. Now I want you to think, why would an alarm be going off? Maybe someone who should not have been exiting is exiting, such as your patients with dementia or Alzheimer's. So are you going to do A, wait a few minutes to see if the alarm stops? B, report the alarm to the charge nurse immediately? C, make the resident being bathed safe and go and check the door right away? D, stop the bed bath and go check on the location of all assigned residents. This one's a little tricky because there are a lot of answers that sound like good answers. However, you are given a bed bath to a resident. Please make sure that resident is safe before you try to go assist anybody else. How do you make a patient safe while you're giving a bed bath? Definitely lower the head of the bed. I'm sorry, lower not the head of the bed, lower the entire bed frame to the lowest position. That's going to help decrease injury from falls. And if you lower the rail while you're providing care, make sure you bring the rail back up. Keep the person warm, keep them covered, put the gown back on them really quickly, go and check what the emergency is. And then once everything is settled and or resolved, you can come back, reheat the water, and of course, resume the bed bath. If I didn't mention, make sure you also leave the resident being bathed the call bell so they can call for help. Okay. 10, gloves should be worn for which of the following procedures? I don't want you thinking about COVID right now because we're wearing gloves for everything, but I want you to think about which of these would be the most contaminating. Okay, so A, emptying a urinary drainage bag. B, brushing a resident's hair. C, ambulating a resident. Or D, feeding a resident. And of course, the one that's going to be the most contaminating, involving, you know, something that could potentially have a bloodborne pathogen, is going to be that drainage bag. So you want to definitely wear gloves for this particular skill. 11, when walking a resident, a gait or transfer belt is often A, worn around the nurse aide's waist for back support. B, used to keep the resident positioned properly in the wheelchair. C, used to help stand the resident and then removed before walking. Or D, put around the resident's waist to provide a way to hold onto the resident. All right, so the gait or transfer belt is a device that we hold instead of trying to hold on to the resident, and it's going to provide support to the core of their body. So normally in the hospital, we hold on to the resident's arms, we walk them to the bathroom. So one nurse CNA is on one side, another staff member's on the other side, but that person's knees could still buckle, and now their knees are, you know, touching the ground, and that would be considered a fall. So when you're using a gait belt, it is going to be D, put around the resident's waist to provide a way to hold onto the resident. It would not be C. Think of a gait or a transfer belt as an assistive device. So think of somebody who needs a walker or a crutch. Are you going to have them stand and then once they're standing, be like, oh, let me take your walker away? So it would not be C. All right. So the answer to 11 is D as in dog. 12, which of the following statements is true about residents who are restrained? Well, you have to think, why do we restrain residents? And the answer that most professionals are going to tell you is that they have to be a danger to themselves or a danger to others. So technically, a resident who's falling is not a danger. They need a sitter, maybe a family member is going to come, maybe you can put a bed alarm, you can get an order from the doctor to maybe put more side rails up, but that person doesn't necessarily need to be restrained. The problem with restraining an individual is that their goal is to now get up. If I tie you down, your goal is to get up. You're going to make that your mission. You're going to fight. So it's not the physical restraint that actually calms a resident down. It's the chemical restraint, or it's the antibiotics, or it's the fluids, or it's allowing us to give, the medications or whatever, is in their system time to work its way out. So when you tie someone down, the answer is A. They're at greater risk for developing pressure sores. And the reason why is, again, they're laying and then they're rubbing their skin against the bed. They're not laying there being still. The answer would not be B. They would not be at lower risk of developing pneumonia. Because they're laying flat, they're actually going to be at a higher risk. The posture and alignment are not improved. If you've ever restrained a geriatric patient, you know they are Houdinis. Tubes are going to be everywhere. Legs are going to be out the bed. So our goal is to keep them safe, but not necessarily to restrain them. And then, as I stated before, the answer would not be D, because when you tie someone down, when you restrain them, usually their goal is to get up. You actually increase their chances of falling. 13. A resident has diabetes. Which of the following is a sign of low blood sugar? And anytime something's low, you'll usually see the prefix hypo in front of it. So we'll call that hypoglycemia or hypoglycemic. And when something's high, think of a very active kid. We'll call it hyper. So if someone's blood sugar is high, they have hyperglycemia or they're hyperglycemic. So fever has nothing to do with the blood sugar levels. So it's not going to be A. B, shakiness, maybe. C, thirst. I don't know, because I know some diabetic patients who've always said they're thirsty. D, vomiting. I've not heard of that one being a sign of low blood sugar. So let's go ahead and try to weed out which one is better, B or C. So when a person's initially diagnosed with diabetes, when their blood sugars are high, they'll have polyuria, polydipsia. Poly means in abundance. They're doing it a whole bunch. So they're going to be urinating all the time. They're also going to be thirsty a whole bunch. So that's when they usually go to the doctors, check their blood sugars, and we find out that they are diabetic. They're usually then given an oral anti-diabetic agent, which is some pill to control their diabetes, or they're given insulin. And now we have to get those sugars regulated, because the insulin is going to bring the sugars down. And if the sugars get too low, the person can become hard to arouse. They can become diaphoretic, which is like this very sweaty, kind of pale looking color. And sometimes it gets so low until they don't respond to you at all. So if you can catch the hypoglycemic episode before the person becomes unable to swallow, you want to give them about 4 ounces of orange juice if their diet allows it. After giving them about 4 ounces of orange juice, you then want to follow that with a protein. So that's why you'll see your diabetic patients getting turkey sandwiches, or one of the reasons why your facilities have peanut butter, on the floors. Give them some peanut butter and cracker, because if you only give them sugar without any protein, the sugars are going to spike and then fall right back down. Okay, and then it's going to be up to your nurse to, tell you how frequently the patient should be monitored after their hypoglycemic episode. 14, when providing foot care to a resident, it is important for the nurse aide to remove calluses and corns. B, check the feet for skin breakdown. C, keep the water cool to prevent burns. Or D, apply lotion, including between the toes. All right, so you all don't cut anything. You're not surgeons. And one thing I tell my students during our CNA classes at Florida Training Academy is you are not a nail tech. You do not clip, you don't cut. They have podiatrists for that. So the answer is not going to be A. The answer is going to be B. Check the feet for skin breakdown, because if you're providing foot care and you see that the person has some type of foot fungus, if they have a cut, if they have a pressure sore, you're not going to continue with the care. You're going to go ahead and notify the nurse, because if you're putting lotion on the feet, etc., and somebody has a cut, or if they have a foot fungus, that can make the fungus worse. The answer would not be C, because you would not put a person's feet in cool water to prevent a burn. You would ask them to check the water temperature. And when you have them check the water temperature, have them check it with their hand and their feet, because if they have diabetes or any type of circulation issues, and you only have them check the temperature of the water with their feet, it may take a while before they feel that the water is too hot, and then they can have an actual burn. And as we stated before, you don't want to be applying lotion, especially not between someone's toes. You can apply it to their feet if their foot is in, a good condition, there's no cuts, abrasions, etc. But you don't want to put it between their toes because fungi loves dark, moist places. So if you put lotion between someone's toes and then put their socks back on, that's going to be a place for the fungus to grow. And then 15 is going to be the last one that we do on this section of the video. 15 states, when feeding a resident, frequent coughing can be the sign that the resident is A, choking, B, getting full, C, needs more fluid to drink, or D, having difficulty swallowing. And a lot of students choose A. But when someone is choking, there is no air exchange. They'll usually make the universal choking sign, and that's when you would do the abdominal thrust, formerly referred to as the Heimlich maneuver. So you make your fist, take the knuckle of your thumb, put it against your abdominal area, and you do upward and inward thrust, okay, to their right above their belly button until the object is expelled or until the person collapses. If they collapse, you'd have to perform CPR. But we're going to go back to the point. When feeding a resident who's coughing frequently, we know they're not choking, because if they were choking, they probably would not be coughing, okay? So if they're coughing, encourage them to cough. But when they're choking, there's not going to be air exchange. The answer is going to be D. This person's having difficulty swallowing. The way that you're going to prevent them from aspirating or aspirating or for the food or fluid to not go down the wrong pipe is you're going to make sure that whenever they're seated, you have them, or they're eating, you have them seated upright. You can put pillows behind their back to sit them up properly. Make sure that the diet matches the teeth. So for example, if your patient ordered a steak but they don't have their dentures, you're going to be there cutting all that food up. You need to cut it up, and then after you cut up that one tray, please communicate with your nurse, because we need to find out what the patient's dentures are. We need to get them to the facility, and if we can't get them to the facility, your nurse is going to contact the advanced provider, the doctor, the nurse practitioner, the PA, to see if we can get that diet altered, because they should not be able to order a steak. Instead, they can get something that's softer, such as a Salisbury steak with a lot of gravy. All right, so I hope that helped you. I reviewed 15 of the 50 questions that, that were available on the Prometric Practice Nurse Aid Examination. Again, my name is Eunice Mathis with Florida Training Academy. We provide CNA and CPR classes in Jacksonville, Florida. Our website is www.flinfloridatraining.com. We wish you much success. All right, thank you. Take great care of our clients and our residents in Florida. We appreciate you.